Hi! Before we talk about the common postural dysfunctions which can lead to back pain in this video, first, what is posture? Well, throughout any given day, we all spend a lot of time in certain positions, for example, sitting in a chair at work. Posture typically refers to how the body positions itself as a whole. Good posture indicates a certain positioning in which our spinal curves remain neutral, not bent forward, backward, or sideways. If one of your postures put your spine out of the natural alignment, your muscles will adapt and become unbalanced. This is called a postural dysfunction. Now, the spine has 4 natural curves and they're essential for shock absorption. And when viewed from the side, we have cervical lordosis, thoracic kyphosis, lumbar lordosis, and sacral kyphosis. These curves are interdependent, and a change in one curve will result in change in the curve above or below it. In a neutral position, the spine is supported mostly by the bony structures of vertebrae resting on top of one another. When these curves become either exaggerated or flattened, the spine increasingly depends on muscles, ligaments, and soft tissues to maintain erect, causing tension in these structures, leading to lower back strain and trigger point formation. Over time, this will lead to spinal disc injuries. So how do we know if we habitually adopt an ideal posture? Well, a basic postural assessment can be done statically or dynamically. The purpose of this is to identify any deviation from the neutral position so that we can highlight any areas of dysfunction. For example, we need to check if the shoulders are at the same level. Is there any anterior, posterior, or lateral pelvic tilt? These pelvic misalignments can cause imbalances of the muscle attached to the pelvis, such as the muscles of the glutes and the lower back. When we conduct a static postural assessment, there should be a straight vertical line joining these points of reference in an ideal posture. The earlobe, the center of the shoulder, the elbow, the center of the hip, midline of the knee, are points slightly anterior to the lateral malleolus. Effects of postural dysfunction on pelvic alignment include anterior, posterior, and lateral pelvic tilts. Poor postures leading to the associated pelvic misalignments can cause imbalances of the muscle attached to the pelvis, such as the muscles of the glutes and the lower back. Let's now take a look at some of the more common postural dysfunctions that can lead to lower back pain. First of all, hyperlodosis. This is a natural curve in your lower back, but if this is excessive, this can lead to an anterior pelvic tilt. Hyperlodosis is a very common form of postural deviation, and the common causes include prolonged sitting, wearing of high heels, abdominal obesity, and pregnancy, which shift the center of gravity forward, flat foot. Hyperlodosis is also known as lower cross syndrome. Hip flexors and the lower back muscles are typically tight and weak. Abdominal core and glute muscles are deactivated. Next, hyperkyphosis. This is particularly relevant to those who spend an excessive amount of time bending forward, protracting the shoulders in front of the computers. The effect of hyperkyphosis on the back muscles are lengthen muscles of the middle back, protract the shoulders, and tighten chest muscles. The condition is worsened if you do a lot of chest workouts in a gym. Tighten upper trapezius, usually with a forward head posture. Posterior pelvic tilt and lumbar flexion. All these muscle imbalances can predispose to lower back pain. Causes of hyperkyphosis include poor postural habits, include spending a lot of time on your phones and computers. Muscle imbalances are often seen in a gym when people focus on the chest and ignoring their backs, leading to hyperkyphosis, typically associated with round shoulders, forward head posture, and internal rotation of the shoulder joint, leading to a decrease in subacromial space and impingement of the rotator cuff tendons. So, what are the effects of hyperkyphosis and forward head posture? First, neck pain. Second, tension neck syndrome. It is perhaps confusing, but the majority of neck pain is caused by trigger point in the upper back and the muscles between the shoulder blades. Trigger points in the neck typically refer pain to the head, causing headache. Forward head posture is common with hyperkyphosis, but it can also happen independently. So how do you know if you have forward head posture? Now let's do a small test. Stand with your back against the wall with your heels positioned shoulder width apart. Press your buttock against the wall and ensure that your shoulder blades are in contact with the wall. Now check your head position. Is the back of your head touching the wall? If it is not, you have forward head posture and should do your best to correct it. Please take a look at my video on trigger point release, stretches and corrective exercises for neck pain. Scoliosis is a condition in which the spine bends to the side abnormally, either to the right or left. In recent years, scoliosis has become more common due to modern lifestyle. People who habitually carry heavy bags on one shoulder or who spend a lot of time resting a telephone on one shoulder may have scoliosis. This sway back posture is a posture in which the pelvis is pushed in front of the center of gravity. The chest is being pushed back. This causes a chain reaction, including a posterior tilting of the pelvis as the body attempts to compensate for the shift in alignment. The military posture is often mistaken as a neutral posture and is typified by the chest being pushed forward and up. It is commonly associated with hyperlodosis and an anterior tilting of the pelvis. The slump posture is a combination of hyperkyphosis and hyperlodosis. Finally, we have the flat back posture. As the name implies, there's a reduction or elimination of the normal lumbar spinal curvature, typically resulting in a posterior pelvic tilt and a compensatory forward head posture. These pelvic imbalances can affect the length-tension relationship of the muscles that are attached to the pelvis, leading to muscle dysfunction, increase in stress on joints, and increase in risk of aches and pains. How to avoid poor posture? Well, start by watching yourself in front of the mirror or even video yourself. Correcting your incorrect posture will inevitably feel awkward at the beginning because you're so used to sitting and standing in a certain way. But it is essential that you're aware of your postural deviation and get this corrected consciously. Remember, it is prolonged static posture that is most detrimental. In fact, some suggest that your best posture is your next posture. Alternating between sitting and standing can reduce pressure on your vertebrae and increase circulation to the legs. And this is the best way to prevent back pain. Thank you for watching until the end. If you like this video, please click the like button. Please subscribe, share and comment. Please also hit the bell so that you will be notified of any new future video release. If you're interested in improving your health and fitness, and if you want to prevent lower back pain, please take a look at my book, which is now available from Amazon. Thank you.